Hello, hello, hello. Good morning, happy Sabbath. So we have a new program here in Scenic Hills called Healthline. Every Sabbath, we're going to be talking to you more about your health because, as you all know, we do have a health message, but it has so many aspects to this health message. And so many of you know I'm the young adult leader here, but I'm also a dentist. So I'm going to be starting off our conversation on dental health this Sabbath because everything that you consume, everything that comes into your body, it goes through your mouth first, right? So we're going to talk a little bit more about dental health. So I'm here to convince you and help you to understand that you can't talk about overall health without talking about dental health because everything that happens in our mouth affects our whole body. Everything is connected. I'll wait for my PowerPoint slides. I don't know if I'm... but before I start before the PowerPoint slides start, we'll just go ahead and start off with some information about your teeth, which I'm going to have on the slides as well. So who knows how many teeth an adult has, a normal, healthy adult? How many? 32, you're right. Who knows how many teeth a child has when you just have baby teeth? You want to guess? Well, 0 initially. 20, that's actually correct. So I'll have y'all advance my slides for me. Okay, so here's some statistics. 63% of adults age 18 and over did go to the dentist this past year. But that means there's a whole nother percentage that didn't. So we won't raise hands here. Many of us maybe do or don't. And so that means there's about 26% of adults aged 20 to 44 who have untreated dental cavities. And then we talk about kids. There's a lot of issues that can happen with kids. There's 34 million hours of school time lost each year because of unplanned emergency dental care. So teeth are very important. And I'm going to talk about a couple things that make them very important. So three major functions. One, nutrition. So who here has had a toothache before? Who here has, okay, were you able to eat the way you normally eat? Were you comfortable eating? Did it affect your diet? Did it affect your nutrition? So nutrition starts in the mouth. That's where it begins. And so it's very important that we have healthy teeth because we want to be able to consume healthy foods. And most healthy foods require a lot of chewing. So, and then the number two thing is speech. I see Jared back there. He's a speech pathologist. Do you need your teeth to produce speech? You actually need your teeth to produce speech. I have patients who have no teeth and they're having trouble talking. So it's very, very important as well. And then my last thing is aesthetics. Your smile affects your confidence and it affects your ability to present yourself in the world. So that's another reason teeth are very important. And I made a note here that oral disease can cause pain, infections, problems with eating, speaking, and learning. And there's 3 conditions that really affect people when it comes to their teeth. One would be cavities, which we'll talk about. Number 2 is gum disease, which we'll also talk about. And number 3 is tooth loss. So I already talked about this. So from starting at 6 months of age up until about age 6 months of age up until age 3, you get your 20 baby teeth. And so that's your first set of teeth. And I believe that God has called us to be stewards. Who else believes that? So you're a steward not only over your money, but you're a steward over your health. And I believe you're a steward over your teeth as well. Because in adulthood, you get 32 teeth, and that's all. So if something is wrong with those teeth, they break, they need to be pulled out, they have gum disease, then I as a dentist have to figure out how to replace them. And there's different things I'll talk about. But God has made us stewards over our teeth, and so that's why we have to take really good care of them. These are all the different types that we have. So we're going to talk about how to prevent dental disease, the consequences, and also dental treatment. So how many times a day do you think you should be brushing your teeth? Someone said once. What else? Someone said 3. Someone said 2. Okay. So you should be brushing your teeth at least 2 times. At least 2 times. So very first thing in the morning when you wake up, you should be brushing your teeth. That's what I recommend. You could do it later, but I recommend that's the first thing you do when you wake up in the morning. The last thing at night, the last thing that touches your teeth should be your toothbrush and toothpaste. It shouldn't be brushing your teeth, then you eat something. It should be, that's the last thing that touches your teeth. And so this is just a diagram to show you there's all sorts of surfaces. You want to brush the front, the back, the sides, the chewing surfaces. You can use circular motions, but you could also use a 45-degree angle so the bristles go into your teeth. But this is so important because this is where it starts. Also, the Bible says, I'm going to relate this to us as Christians. The Bible says, train up a child in the way he should go. When he's old, he will not depart from it. So what should we be teaching kids? You brush your teeth twice a day. I have patients who tell me, my parents never taught me that. My parents didn't enforce that in our household. And now they're still facing consequences today. So we want to teach kids as well, and adults alike, you need to brush your teeth 2 times a day. Not only 2 times a day, but for 2 minutes. So you can figure out a timer. Some people say sing happy birthday a couple times, 2 minutes. So it's not a quick thing. You have to take your time with that. How often do you think you should floss? Maybe any guesses? Once a day. You're right. So flossing should be at least once a day. But on average, most people are doing it 0 times per day. I'm not going to take a poll. Most people are not flossing at all. But flossing is very important because there's areas between your teeth that you cannot reach with a toothbrush. The only way you would reach it is with floss. So I'm recommending that you can get regular floss. You roll it around 2 fingers and use it to clean in between each teeth. That could be morning or evening, just 1 time a day. So that's one thing. So I'm going to have some pictures. Hopefully I don't gross people out too much. I showed them to some people beforehand. They said they're not too bad. So in addition to brushing twice a day, flossing once a day, you want to see your dentist 2 times per year. And as you can see in this picture, the before and after, there comes a time where you cannot actually remove everything. There's some under the gum line. Hopefully your teeth don't look like that. But if they do, a dental hygienist or a dentist can fix that. So you want to see your dentist 2 times a year. We're going to clean your teeth more thoroughly than you can. We're also going to examine your teeth with x-rays and clinically just to make sure there's nothing going on. And then the last aspect is diet. You want to very closely monitor your diet for the process of sugar, carbohydrates, fermentable sugar. It's not just candy, but it's really in a lot of things that we eat. A lot of snacks that you think, if you start looking at the sugar content of everything you're consuming, you'll realize there's a lot of sugar in everything. You want to monitor your diet because the more time it has on your teeth, if you're not cleaning your teeth adequately and you're also not seeing a dentist, you're more prone to other issues. So we're going to talk about some of the consequences of dental disease. So I'm going to talk about cavities and gum disease mainly. I have pictures. Hopefully I don't gross y'all out too much. I tried to pick ones that weren't that bad. So I want to explain that the mouth is a part of the whole body. And so you're going to see different health professionals up here from now on. You're going to see physicians. You're going to see all sorts of people in different aspects. But we went ahead and started off with dentistry because we wanted to make sure we start with the mouth and then we go down. But you may or may not know your mouth is connected to your overall health. So, for example, if you have gum disease, you are more likely to have diabetes. Or if you have diabetes, you're actually more likely to have gum disease. Everything's connected. If there's bacteria in your mouth and it's more than it should be, it can spread from your mouth to your heart and cause an infection. If you have a toothache and it's never addressed, the bacteria from that toothache can spread to other parts of your body. So your oral health is important. And then the next picture shows you what's called dental decay or cavities, which I'm going to talk about. It can start off just shallow in the first layer, but the tooth has different layers. And it can move from the enamel to the dentin, and then it can move to the pulp, where you have a nerve and blood supply. And that's when you get a toothache. That's when you might need like a root canal or an extraction. So this is what we call tooth decay. So I'm going to show you a picture, which is a cavity. So a cavity happens when your tooth, which is in your mouth, has opportunity to contact with sugar, and the bacteria in your mouth consumes that sugar and causes the breakdown of your tooth. So it might look like this, but it also might not look like this. It might not look like anything to you, but it might be something that only I can see when I look at your tooth under magnification, or it might be something that only shows up on an x-ray. And also, you might be in pain, but you also might not be in pain. So what I'm saying is it doesn't mean only when you're in pain, that's when you have a cavity. Because sometimes patients will say, well, I don't have pain, so I don't believe you. And then I'll show them the x-ray. It can happen to anybody. But what you need to be doing to prevent this is brushing, flossing, what we talked about, seeing your dentist twice a year, and also minimizing the sugar in your diet. And so another thing that can happen is gum disease. So we've all maybe seen when someone's gums have receded. As you know, there's gums in your mouth, and they're very tight and firm, and they hold onto your teeth. But after a while, if bacteria gets in there, and you're not flossing, you're not brushing well, you're not seeing your dentist, the bacteria goes deeper in the gums, and the tight gums become loose, and they start to move down the tooth surface. And it starts off as a reversible process, and then it becomes irreversible, and it causes what's called bone loss. And once bone loss happens, it's hard to fix, I'll say that. We can fix it, we can graft it, but it's very difficult. So once this happens, it's called gum disease. This is more common in the elderly population, just as a function of time, but then I see it in young people as well, especially if they're not taking good care of their teeth. If you're diabetic, you're very likely to have this as well. And so some of you will say, my teeth don't look like that. You could still have gum disease. I've seen patients with young patients with a smile that looks pretty good, and they still have gum disease, because once we go in and do our examination, we do measurements. You might hear us calling out numbers. We do a lot of different things. If you notice that when you're flossing, it bleeds every time, or when you brush, it bleeds every time, that's something wrong with that. That's most likely inflammation or gingivitis, or it could be gum disease. So gum disease starts off, and it's a progression. So it's just a little bit inflamed, it's gingivitis. We can probably just fix that with a cleaning, but then as it goes on further, it can become severe gum disease. And so you might hear your dentist or your hygienist say you need a deep cleaning. It's called a scaling. That's at that point we have to really numb you and really get in there to clean everything out. So quickly, I'll just go over some ways that we treat dental diseases and terminology that you've heard. So if you have a cavity, we can fix that, we can fill it. If you have teeth that have broken down, or you have teeth that you've worn down, we can also fix that. Most of the materials we use now are aesthetic, so we're not gonna try to put silver or gold in your mouth unless you want it. I have patients who want gold crowns, I can do that too. But most of the times we're gonna restore your teeth in a way that looks natural. You may have heard your dentist say you need a root canal. A root canal is just where your cavity has gone so deep into your tooth that it's gone to your nerve and blood supply. And at that point, we're gonna clean everything out, the whole entire root canal, and we're gonna fill it back up. We've all seen people who have fake teeth. So there's dentures, partial dentures, complete dentures. This is where you've lost multiple teeth and we need to replace them. If you just have a couple teeth missing, we could do a partial, but if it gets to a point where, especially like I said, in our aging population, there's a lot going on with bone loss and gum disease and cavities, you may need complete dentures. Hopefully nobody here does, but we do those as well. And then if your tooth has broken, we could do a crown to protect it. Or if you're missing a tooth, we could do a bridge to replace just one tooth that's missing. The last slide is implants, which are kind of the way of the future. And if you're missing one tooth or one tooth in a couple areas, we could do an implant. And so it looks very complicated, but it's basically a way of replacing a single tooth with a titanium post, and then we put a crown on top. So these are just some of the things I wanted to share with you. If you have any questions, you can email me, but with our new Healthline presentation, every Sabbath, you're gonna see a health professional in a specialty, 1 week present on that specialty, and then the next week is a Q&A for that specialty. So it's me for 2 weeks, and then we'll have another health professional. So if you have any dental questions, because I barely scratched the surface, you can email them. But the other thing is all of our Healthline presentations will be on our Scenic Hills YouTube page. So if you go to Scenic Hills, if you go to YouTube and you type in Scenic Hills SCA Church, you'll see we always stream our services. Now, each time we do the Healthline, we will put a specific video. So you can share this with a friend. Every specialty that comes up, you can share that video. And you can go on that video and YouTube and make a comment with a question. Those are the questions they'll be asking me next week about dentistry. So if you have any questions at all, email them to me or go on the Scenic Hills YouTube page, and then you can make a comment on this video, the dental health presentation. So that's all for today, and then we will resume with our divine service here in a few minutes. Thank you.